A lot of private equity and venture capitalists have jumped on board the healthcare bandwagon in recent years. And I've worked with many organisations where the board and the executive have mapped out this classic hockey stick projection for this incredible growth in the next financial year. And there isn't really an issue with that per se. The issue is when they don't really plan for and execute amazing things to achieve that growth. So we all know in healthcare, there isn't a magic pill, and there also isn't a magic pill in healthcare business. But to realise commercial gains that perhaps have been planned for, you need a couple of key rules to stick to. Number one, understand and optimise the funding mechanisms. Know who's paying, how they're paying, and how you can optimise that funding. Number two is optimise productivity and efficiencies. If you don't do this, the small margins that you do have in healthcare will simply erode. Number three is leverage technology. If you aren't already doing that, you're already behind the eight ball. And the funding mechanisms really expect you to bring technologies and efficiencies to the game, and that's what they're really paying for in funding today. Number four is keep it patient-centric. So to be sure to ask, listen, measure, and actually act on patient feedback. They are your greatest advocates. Finally, really understand what drives that upward tick of your hockey stick and focus on your efforts and resources on the things that will actually impact and drive that forward projection. And be sure to quieten any other distractions or noise throughout the business and throughout the team to ensure that everyone is aligned with those priorities and that you can actually achieve that growth.